Great. Well, thank you for joining me today. We're going to be talking now about times when there is really high adversity against both service members and their families. We're going to be talking about sexual assault, sexual harassment a little bit, and child maltreatment. And I'm serving as the moderator today because Rand just completed the military workplace survey, which looked at sexual harassment and sexual assault in the military. And so I'll be talking about a few of those findings and getting reactions from our panelists. So let you each introduce yourself, and then we'll get started.
Sure. I'm Debra Gibbs. I'm a senior analyst at RTI in North Carolina with a background in child maltreatment research. And I've spent a number of years working closely with the Army, studying the interactions between child maltreatment, intimate partner violence, and substance abuse.
Thanks.
Hi, I'm Kate McGraw. I'm a clinical psychologist. I started my Department of Defense career as one of the first female missile officers in the United States, and then the Air Force paid for me to get my PhD, which is really wonderful, and then I served for a number of years doing that, active duty. I left, went into the civilian sector, and then joined DECO about 5 years ago. In some of the work that I do for the DoD now, I'm leading the Sexual Assault Advisory Group to the Psychological Health Council, and I also lead the DoD's Women's Mental Health Issues Task Group that focuses on the mental health needs of women in service, as well as the mental health needs of sexual assault victims, both genders.
My name is Sara Nett. I'm a clinical psychologist, and I work for the VA Maryland healthcare system. Mostly I'm located at the Baltimore VA. I am a clinical psychologist there, but also work primarily with men and women who experience sexual harassment or sexual assault during their military service.
Terrific. So to organize this, I think we're going to kind of start at the adult level and look at active duty, sexual assault, sexual harassment, and kind of move to the transition as they're leaving active duty and maybe seeking services at the VA. And then sort of shift into the family realm more and talk about child maltreatment. So let's start with sexual assault, sexual harassment. Our recent study, the 2014 study, showed pretty high rates of sexual assault in the past year. Just under 5% of women and 1% of men reported something that would be consistent with a UCMJ crime of sexual assault. Do you want to talk about whether those numbers line up with what the DoD's seen before? And
well, we know that what's reported by service members through the official channels to make those reports, those numbers are different. And we have a lot of ideas about why that might be. So it is difficult for military members to come forward and talk about sexual assault. It's hard for them to feel confident with the system. And there are a lot of changes, a lot of things going on in the DoD to support individuals coming forward. We're working on healthcare provider response to sexual assault disclosure. We're working on strengthening the special victim advocates that the services provided to victims, both male and female. And those numbers are not good, because one, sexual assault is not a good thing. But we certainly are hoping that we see more services, more support, and more people come forward to get the services that they need and the support that they need.
How are the sexual assaults experienced in the military different or similar to the kind that we see in the civilian sector? Either of you can comment on that in terms of the ways in which these assaults might be different.
Sure, I can talk about that. Yeah, I think one of the things that is important to understand is how the context can be a little bit different during military service. And one of the things that really stands out is when service members experience sexual harassment or sexual assault, they are most often living, working in the environments where those acts took place. And so oftentimes following these experiences, they have continued contact with the perpetrators of either the harassment or the assault, which can lead to prolonged psychological and emotional distress, as well as increased rates of re-victimization, putting them potentially in harm's way or in danger of additional acts of violence. So that's one way that I think sexual assault in the service can be a unique sort of experience.
I would also want to add for those that don't understand that sexual assault and sexual harassment are two different types of events in the DoD. They're managed by different programs. One is enforceable as a crime, the other maybe not so much unless it involves contact. That the VA and the DoD have different definitions of that, which makes the research a little confusing to conduct and do cross-study comparisons. But there are some differences. I think that in some ways the DoD has more protections and more a more robust response than an individual may have in the civilian community. I don't know what your thoughts are on that.
Say that again.
So in the DoD, we have a lot of structure in place to respond and provide support and services, whereas a civilian that might be sexually assaulted may not have either the information or the knowledge or the structure, know where to go as much.
I was going to add, and also not know where to go oftentimes without having that sort of guidance of that system that's in place.
So thank you for bringing that up. The sexual harassment and sexual assault are very different systems and different law governing the events. One of the things we found in our study was that about a third of people who reported a sexual assault in the last year said that the assailant had previously sexually harassed them, with sexually harassed left up to their own definitions. But we also found that individuals who reported sexual harassment in the last year, by our definition, the way we were sort of calculating it on the survey, that women were 4 times more likely to be sexually assaulted in that year as well, and that men who had been sexually harassed were 49 times more likely to be assaulted in the same year. So how do you think that those kind of go together, or do they, in the military? Why is there such a strong relationship between sexual harassment and sexual assault?
So it's interesting that the male figures that you just quoted are significantly higher than those of the females. And I wonder, I mean, there's this whole issue of bullying and hazing and unit, I don't know if you would call them rituals or what you would call them, that is increasingly being focused on in the DoD. There was a new policy that was released back in, I think, January, February, that prohibits bullying in the workplace and workplace violence. But there's not been a lot of emphasis on that. And there's lots of different ways to bully and haze people. And so men are more likely to probably participate in that and not be aware that if there's sexual conduct involved with that constitutes sexual assault. And so, I think that some of the current ideas about that is that there's a continuum, that sexual harassment, it kind of starts the ball rolling, and then people cross boundaries, and as boundaries are crossed, then worse things happen. So those are some of my thoughts.
So some of our findings are really relevant to that as well. So the men on this was the first really large survey where we had enough men reporting a sexual assault in the last year that we could look at the characteristics. In the past, there were just too few to really get good numbers. And what we found is that men were much less likely than women to call it a sexual event, and rather they talked about it being abusive or humiliating. And about a third said that they would consider the event to be hazing. So that's just in line with what you were saying. And what it calls to mind for me is that a lot of the systems that have been set up over the years have focused on women, and rightfully so, because they're at much higher risk. But they all are talked sexual assault response coordinator, sexual, all of the words sort of talk about sexual assault that in those systems. And I wonder, for a man who's experienced this kind of event and is not considering it to be sexual, but rather a hazing type of event, whether he might find those to be welcoming systems, or whether the DoD might want to be considering other ways to help support men who've had those kinds of experiences. What's your thoughts?
Well, it's really, I don't know if the audience knows this, but there are actually usually more men in numbers that are sexually assaulted than women, but women make up a smaller percentage of the force, so it appears like it's a larger ratio, essentially. And so there's an increasing interest and focus on understanding the needs of male sexual assault victims, which has not been the focus in the past because of, I guess, just the public perception that women are more likely to be victims, and maybe the male's hesitation to come forward or to understand that what they've experienced has been a sexual assault. So.
And to call it that.
Right, and to label it with those words. So.
And what about at the VA? So in terms of the different programs that are set up to support people who've experienced sexual assault, what is sort of the ratio of men and women? And
yeah, I think the ratios are very similar in the VA as well. And one of the things that we're working on constantly at the VA Maryland system where I work is trying to educate both our veterans and our staff members that this is something that happens to male and female service members. Making sure that we have, recently there was a new brochure that was published with the help of the National Military Sexual Trauma Support Team that targets men specifically. So it's a male brochure, which is really helpful for men to see men on the cover of this brochure rather than just to see female service members, and helping physicians across the hospital, medical providers, mental health providers in understanding that this is something that we need to be thinking about with every veteran that we treat regardless of sex or gender. So just really doing a lot of in-reach and outreach to make sure that people are starting to think about this for our male service members and veterans as well. Mm-hmm. And making sure, of course, then that we have programming available for both also. So in the sort of mental health departments, making sure that not only do we have the information present for both men and women, but also that we have those individual therapy services, group services, services for families, and that are also targeting couples, not just the female, but also the male veteran or service member.
Okay. We know that most of the sexual assaults that happen while people are in active duty military are in a military context. 85% of the assailants are in the military. 65% of these assaults are happening on a military installation or a ship or reserve guard sort of training center. So it's mostly in the military context, but then of course there are assaults that happen at home as well. Intimate partners, and these would obviously have impact on the family and involve other violence as well. So I want to shift gears a little bit and talk about the impact on the child or the family, both in terms of the sexual assaults that happen in the military context and things that might be happening at home. Would either of you like to comment on that? Or this starts to get into your realm as well, Deborah, so do you want to take it over?
In terms of child maltreatment, child sexual abuse, it's fortunately very rare, and it's always classified and responded to as serious child maltreatment in the military. But that would only refer to sexual abuse within the home. So, and I think in both contexts, in both military and civilian context, it's very rare. So I think you're talking, it's very different at an adult level.
So one of the interesting things that we're doing at the Defense Centers of Excellence, along with a number of other people, so we're working with SAPRA and we're working with Health Affairs, we're building clinical support tools for providers to help them understand when to refer to family advocacy, when to refer over to SAPRA. And it gets a little confusing because if there's sexual assault between intimate partners, then it's not a SAPRA issue. And we want to make sure that nobody misses out on services or responses that they can do. So we're building some tools to help providers understand how to refer when a patient comes into the system. But the systems are very well constructed on both sides. They're just looked at differently. Different systems stand up when sexual assault is within the family system.
Mm-hmm. And just to be clear, there is a system to respond to sexual assault within an intimate partner relationship, but it's through the family advocacy program.
Right.
That is intimate partner violence.
Yes.
Do you want to shift gears and talk a little bit more about risk factors for child maltreatment and what might be different between military families and civilian families?
Sure, and a lot of things I'm going to say touch upon several themes that have been heard throughout the day in terms of risk and protective factors and the things that support parents and children and the things that create difficulties for them. And this, here we're just shifting the lens and shifting our focus on that bell-shaped curve to the families that might be having the most challenging times of all. One basic question is whether child abuse and neglect are more prevalent in military populations than civilian ones. And research is tough to do, but the best studies, the ones that have looked at large-scale populations and reported data conclude that child maltreatment, child abuse, and neglect is actually less prevalent in military families. Dr. Koza talked about the kind of protective factors that the military environment provides, and those are all terribly relevant for child maltreatment. You have many more two-parent families, which we all know, many of us know that's important to spread the stress around sometimes. You have at least one person in the household who's capable of getting up and going to work in a structured environment. You have steady income in the household, which is not true of many families. And you have very low rates of illicit drug use, which is a factor in about half of child maltreatment cases in the civilian world. So those are all great things that protect children. You also have close communities where somebody's likely to know and likely to feel it's their responsibility to speak up if they see those strains. But there's also those same risk factors that we've talked about that make it difficult for a lot of families to be their best. Frequent moves, long hours, unpredictable changes, very, kind of high levels of stress. Military families tend to be young parents and tend to have very young kids. And they also, you have deployments, which, ratchet the stress levels up to enormous levels. So it's important to acknowledge the fact that most military families, as Dr. Campese was saying, do extraordinarily well in these circumstances as we address those that have the most difficulties.
And is there good data to show that deployments increase rates of child abuse and neglect in the military families?
Absolutely. There's a few studies that looked at entire populations. First, Ed McGraw looked at data from the Army over a period of about 15 years and found that during the 90s, even during the Persian Gulf Wars, the rates of child abuse and neglect were going down pretty steadily. But after 2001, rates of child neglect started rising pretty dramatically. Another epidemiologist, Danielle Rentz, looked at data that was reported for the entire state of Texas, military and civilian. And before 2002, the rates in the military were about a third lower than the civilian ones. But after 2002, the military rates started doubling, so that they then became higher than the civilian rates. Our work at RTI, we had access to all the child maltreatment reports for the entire Army and deployment dates. So we were able to look in a very fine-grained level at among families who did experience child maltreatment and who had a spouse who deployed, either spouse, what was the likelihood that those incidents occurred during the time when a spouse was deployed. And what we found was the rates of child maltreatment were about 3 times higher during the times when one of the partners was deployed. They were twice as high, nearly twice as high for physical violence, and nearly 4 times as high for child neglect. So, and again,
Very rare, but increasing.
but very worrisome.
Yeah.
And not at all to take away our admiration for the families that do extraordinarily well under these circumstances. But when you think about and you talk to people about, well, what does this look like? What is really happening here? Child neglect often consists of the parent who's home, who's not coping well, who's overwhelmed by stress and depression, and just stops being able to function as a parent, stops getting out of bed in the morning and getting the kids off to school, especially in the military where people are able to notice these things. That's picked up and it's treated as a case of child neglect because the child is not being adequately parented. In all child maltreatment research, we know that depression is a huge risk factor for child maltreatment. If you've ever been through depression or if someone you have you can't parent well when you're struggling with depression.
Yeah. And what are the support systems that are set up to sort of both detect and intervene with child maltreatment?
Well, the Family Advocacy Program is specifically charged with looking at identifying and responding to child maltreatment in the military. They work very closely with civilian child welfare to do this and communicate and have a memorandum of understanding as to how they'll coordinate. So typically, there's an agreement as to who will do the investigation, who will provide the services. Usually the services are better on the installation and more accessible as well. So that's where the services go. One thing that was great as a result of all the research that was going on in the mid-2000s about the effective deployment is that there began to be some great efforts to respond to what was going on. Physicians were required to screen for depression when they were seeing a spouse in the office, and if there were kids involved, to make referrals. The military put in place some extra services like respite daycare to support the parents who were getting overwhelmed. And these, not only highlight the importance of providing services to military families, but they start laying the groundwork for the long-term services and supports to help families during times of increased operations, and also to develop the more supportive and resiliency building interventions.
Okay. And Kate, you wanted to...
I just wanted to add also the new parent support program is terrific because if a person is a first-time parent or has children under a certain age, they get screening, and if they're seen to be high risk, then there's intervention. And if that person is going to develop depression, at least there's a lot of support around them to lower the risk of child maltreatment.
Yeah, and that's one of the most evidence-demonstrated interventions there is.
So we have these very low frequency but very worrisome events happening, child maltreatment at home. We've talked a little bit about sexual assault and sexual harassment for the adults. I think we kind of skirted off the issue, though, about the way in which those sexual assaults and sexual harassment experiences at work might trickle over and impact the family. And do either Kate or Sara, do you want to talk about that?
I can talk a little and maybe you can join in. Obviously when someone has a traumatic event occur, everybody's going to respond differently, but there's typically going to be some impairment in functioning. And if an individual is impaired in their ability to just function, to take care of themselves, they're probably not going to have a lot left over for their spouse or for their child. And so, and again, everybody responds differently. Some people develop symptoms that require treatment. Others are able to cope with other coping skills, but certainly it's going to impact a person's ability to be emotionally available to people that depend on them.
I'm not sure I have anything much to add to that. I think, yeah, definitely just this sort of ripple effect that would be felt throughout the family, both with spouse, significant others, and children.
And most of the services available for individuals who have either post-traumatic stress disorder or depression tend to be pretty much focused on the adult individual. Are there any models that are being used where more of the family drawn in and start to involve spouses and children?
So sexual assault is not a diagnosis, right? So we're treating the symptoms of whatever the trauma produces in the individual, and there are evidence-based treatments for couples that have PTSD, for instance, and there's evidence-based treatment for different types of diagnostic categories depending on how the person presents. So I think the answer would just depend on the situation.
So the most common would probably be post-traumatic stress disorder or depression, but certainly there could be other problems as well, and many people are able to, recover on their own without treatment. But I do think some of these models where the spouse is involved and family drawn in a little bit more can be helpful to sort of address. It kind of gets back to the last panel about you can only be as good a parent as you are in terms of your general functioning, and you made that point as well. So if you're struggling with something, then it's going to make it harder. I also think it has implications just sort of for the military workforce, because we know that a lot of military families are producing the next generation of service members, and if the experiences in the military are bad ones, either through sexual assault or sexual harassment, then it might be less likely that the family is going to sort of stay connected with the military and be that sort of national resource that we all are counting on.
I would just add to the conversation that we're having too, that we're sort of talking about sort of the more immediate aftermath, I think, and one of the things that we often encounter in our work with, whether it be the person who experienced the assault or their family, is that there's often a rather lengthy period of time where no one knows what happened except for the person who experienced it. So they haven't maybe told family and friends, their significant other spouse may not know. The children, certainly if they're younger, are not going to be aware most likely. And so there's often a period of maybe even many years where the person is sort of suffering in silence. And there may be, as Kate mentioned, a lot of different methods of trying to cope, many which may be very healthy and a lot of resilience, and some which may be pretty unhealthy. So a lot of maybe substance use or risky behaviors. And so I think it's also important to just sort of to think about that potential effect on the family in a long-term way also, while there may not be sort of awareness of what's going on.
Mm-hmm. Great. I think I've asked all my questions, but is there anything that you were really hoping to say today that we haven't covered yet?
I think the one piece related to children that I'd like to bring up is what's happening as family members, as service members return from deployment
Mm-hmm.
and go through that long period of reintegration. And again, other people have touched on that as it applies to health and family functioning. And for the families who are most at risk, it's again an area of concern. Families have been separated. Everybody's been under different kinds of enormous stress, and people have grown and changed. So when the family system comes back together, it doesn't necessarily work as it did, and that can create huge stress, particularly if the service member has a psychological injury or a physical injury that's affecting their functioning, making them less likely to function well as a spouse and a parent. The good news is that good news for children is that there has not yet been research, and one study with a large sample didn't identify any change in the rates of child maltreatment related to post-deployment periods, which may be a success of intervention and support and reentry programs. Mm-hmm. The area of concern that does affect kids is that we know, going way back to the Vietnam era, that period is a time of huge increased risk for domestic violence and intimate partner violence, and that's something that affects children in a number of ways, either just through the trauma of seeing and overhearing things, or through a child being accidentally or inadvertently or deliberately injured in the course of an altercation, or through one parent being less able to function well as a result of an abusive situation. So those are areas of concern that extend out to children. Mm-hmm. And those are the reasons why some of these support services that we're talking about, again, are so essential for the whole family.
And extend into that redeployment
Yes.
period. Yeah, thank you for adding that. All right, well, I think we've done a good job of a high-level covering of the terrain, from bad experiences for the adult in terms of sexual harassment, sexual assault, the way that trickles in onto the family and can impact children and spouses, and then things at home that can happen and be exacerbated by the deployments, like in terms of child maltreatment and domestic violence. So thank you very much for participating, and appreciate your time.
Thank you.
Thank you.